Hi, everyone, and thanks for joining us for CIO's virtual event on the new business process mandate, AI and automation at the center. I'm Derek Hulitsky, Vice President of Content Development and Strategy with CIO and IDG. Long before COVID-19 struck, organizations were finding traction by streamlining digital processes, with many of these efforts powered by AI and automation. In the aftermath of COVID-19's impact, many IT organizations find themselves doubling down on these digital initiatives. Much of this accelerated transformation emphasizes operational efficiency and transforming existing business processes. Joining me today is Venkat Koshanam, CIO of the Maryland Health Benefit Exchange, the organization responsible for Maryland Health Connection, the state's health insurance marketplace under the Patient Protection and Affordable Care Act. Venkat, welcome, and thanks for joining us today.
Thank you, Derek, and thanks to all of you folks at the IDG CIO team. We truly appreciate this opportunity. And I would like to go through very briefly about what our organization is and what is information technology, providing the support to the organization, and that translates into consumer benefits in terms of providing the healthcare the consumer desperately needs, especially in the time of COVID-19 pandemic. The Maryland Health Benefit Exchange is a public corporation and an independent unit of state of Maryland. And this exchange is responsible to create the state's health insurance marketplace and operate the health insurance marketplace. And today in our exchange, we provide a lot of services to our consumers in terms of providing the insurance for Medicaid consumers, for qualified health plan consumers, and children requiring health insurance plan, and small businesses requiring insurance for their employees and families, and for folks who require family planning services insurance coverage, as well as dental insurance. A health exchange is a marketplace. It's an online marketplace where our consumers walk into the exchange and require all the services that they want, and we take them seamlessly and give them end-to-end coverage to get their insurance coverage as quickly as possible. Here you can see the exchange enrollment trend for the last several years since the exchange was established in 2013. And you can see the trend is pretty slightly more than what you see in nationally. We have almost around 1.1 million Medicaid consumers and 160,000 qualified health plan consumers. And systemically, we do 99% of our consumer renewals automatically in terms of QHP. And in terms of Medicaid, due to various policy requirements, currently it is staying at 55% of automatic renewal. And our goal is to get it to 75%, 80% down the line. And I want to give a brief overview of technology. What do we do for the exchange? What information technology does for the exchange and the consumers? The mission and passion for information technology function is to provide all our customers, stakeholders, and colleagues alike a reliable and engaging technology platform. Our expert service delivered rapidly and consistently with integrity and open communication. We strive as a team to achieve these objectives and contribute immensely towards our common goal of serving Marylanders in providing affordable and accessible healthcare. As you can see, we are a team of more than 140 staff with tons of skills and expertise grouped around the areas of system operations, security, infrastructure, application development, testing and quality assurance, EDA operations, special projects, Salesforce applications, and the project management office. Each of these teams work in concert with every other team within IT and with all the MHBE teams and with our external partners. So what is the exchange technology? Our exchange platform called the HBX system consists of the consumer portal, the backbone of our exchange, utilized by more than 1.2 million consumers, the worker portal used by our call center team and interagency workers supporting our consumers, the marketing portal assisting our marketing team to do outreach, which is very tightly integrated with our HBX platform, and the chatbot Flora, an artificial intelligence-based bot solution for assisting our consumers in their queries, in providing basic technical support as well. The HBX solution also comes in both web and mobile app options. The Enroll MHC mobile app is our flagship mobile solution for consumers. We have built an integrated customer relationship management system that has supported more than 4 million consumer inquiries so far. And obviously, being a government agency, there are a lot of documents around. As you can see, there are 24 million documents are catered to at this time. However, our strategy is to use enterprise automation and artificial intelligence to do a lot of manual work systemically, automatically, and through the utilization of modern technology. And in order to provide all these services, we work very closely with several external partners, such as our insurance carriers, our managed care organizations, federal agencies such as the CMS, IRS, and state agencies such as the Maryland Department of Health, Department of Human Services, Department of Labor, Controller's Office, State Board of Elections, etc. So as you can see, these transactions as a government agency, in order for them to make it successful, we need to have a very tightly integrated system. And tight integrations comes with utilizing modern technology, not relying on legacy age-old technologies. And as for the IT, our core IT goals are very simple. Achieving excellence in operations, providing an engaging and reliable platform for our consumers, enhancing our systems to rapidly address our policy requirements, and continuously modernizing our technology platform. Great examples for this year are artificial intelligence and enterprise automation implemented throughout our system. So we'll talk a lot more about it. And the Maryland Health Benefit Exchange is not a typical state agency that you may find elsewhere. This is a very agile team, and we do a lot of things very rapidly. As you can see, our roadmap for 2020 is very busy. Every month, we have a release. What we call as a release is almost 30 different scope items going into production in terms of enhancing our system, or in terms of implementing policies, or in terms of rebuilding our system to engage more with our customers, or in terms of implementing more modern technology to enhance the platform as a whole. We have 4 different streams. The first stream you can see are the special projects, which is where some of the critical technological innovation are implemented. And sometimes special projects take care of emergency situations, like what we saw in COVID-19. We implemented a special enrollment period. Within a couple of days, government announced that we want to serve our consumers, we want to give them a coverage, and we implemented a special enrollment period. And within few months, we have enrolled more than 50,000 consumers, provided them the coverage that they desperately need in this pandemic situation. And the enhancements are our bread and butter. And this is where all these policies are going into the system. And all the system development, any other system additions, any system modernization, all these effects are going into enhancements as well. And we do have the maintenance and operations releases that take care of our operations and building our operations to an excellent level. And last but not the least, we have an integrated Salesforce platform, which is tied very tightly with our exchange solution and to support our consumers. And the continuous innovation is our theme. In this year, we have successfully implemented conversational artificial intelligence solution. Our chatbot Flora provides consumers the required information through intuitive conversation. And down the line, we are going to enhance this beyond providing responses to the consumers. We are going to integrate the solution into our business flow and provide the support the consumer desperately needs while filling up the application form for insurance coverage. And we have implemented optical character recognition technology, and we are expanding this beyond what we have right now in terms of providing automatic validation of consumer documents, and thereby reducing dramatically the time that the consumers need to get the right support from the exchange. And our pet project this year is the responsive consumer engaging design. We are revamping our website. First phase has already gone live. The second phase is going in a few weeks. And we are going to completely revamp the end-to-end online marketplace for Medicaid and QHP platforms. And this is going to give a unique navigation experience across the devices for all of our consumers. And not only that, we are changing the way how the policy questions are structured, making it more friendly, more useful to the consumers, as opposed to asking a typical government-like question. And upcoming initiatives are a lot this year. Again, the focus is on enterprise automation. Our core transactions have been automated. And however, we are going beyond that. And we are going into audit and compliance, program integrity, and system operations and security as well. And we have other cool initiatives where we would like to integrate our system with the Maryland tax agency to help consumers automatically enroll into health coverage if they choose to at the time of filing taxes. So that's a cool initiative. We hope to cover at least 200,000 consumers into our healthcare coverage system through this automated enrollment. And we are also working to revamp our worker portal, which is basically supporting all our 1.2 million consumers through the use of our call center workers and our state workers. More than 1,000 of them are currently using that. And we are going to revamp. That's a great initiative as well. And again, conversational AI to enhance consumer experience and implementing more engagement tools through AI and RPA, the robotic process automation, are key for this year. So how do we do it all? We are exceptionally good at working as a team. Our ability to channel our human capital as a team with a focus on consistently meeting MHBE's larger goals in a highly organized way is our strength. I meet with my IT leadership team every week to brainstorm, discuss, dissect, prioritize, and execute our strategies and goals continuously. As a team, we arrive at a series of action items for all of us across the IT organization. We do all this effortlessly as a team with our own flair and fire that are unique to each and every one of us at the exchange. Thank you all for your time. Thanks for watching.
Thanks, Venkat. It sounds like the success there is not just about serving the constituents with technology, but also with good integration with all the agencies that you partner with. So I'd like to begin by asking you about the Maryland Health Benefit Exchange mission. Can you tell us a little bit more about the organization's objectives overall?
Yes, thank you, Derek. You are right. The exchange was started as a public corporation and an independent unit of state government. And the exchange is responsible for developing and operating the Maryland Health Connection. This is a state-based health insurance marketplace for Maryland residents and small businesses to explore and compare health coverage options, determine eligibility for tax subsidies and credits, and enroll in private and public health insurance plans. Our mission is to provide accessible and affordable health coverage to all Marylanders, with the vision that all Marylanders will have and use the health coverage that is best for them. And we go by the 7 guiding principles, which directly correlates with our mission, which is accessibility to ensure that health coverage options are attainable for all residents, and affordability to promote health coverage costs that remain at a reasonable level. Financial assistance is often available for households earning up to 400% of federal poverty level. And sustainability and stability are key for the exchange in the long run. To remain viable in compliance with the Affordable Care Act by offering approved qualified health plans for individuals and employees of small businesses, and determining eligibility for tax credits, to provide a reliable source for residents to obtain health coverage. So these are our core goals, and health equity is a very important factor as well to attain a true level of equal access to health coverage for everyone who needs it, regardless of socioeconomic status, especially in this pandemic situation, is very critical. And flexibility is also key to remain adaptable to insurance market changes, as this is very dynamic, and to remain sensitive and responsive to the people the agency serves. And as with any government agency, transparency is key, and to remain open and accountable in its operations and to continue to abide by the rules and regulations that govern the agency is very important for all of us. These are reflected in every thing that we do, whether it's technology or it's policy or finance or our business integration. We see this in everything we do.
Got it. Well, it sounds like having this up and running so efficiently is even more critical at a time when there's a health crisis like right now. So your organization has again been awarded by our CIO100 program. So can you tell us a little bit about this year's award-winning project and how it involves technology-supported business processes?
Yes, absolutely. We are honored and privileged to be recognized by the CIO100 Award 2 years in a row. Thank you, Derek and team team at the CIO100 and ITC. We really appreciate that. This recognition is a source of encouragement to our team that is working day and night in and out to support Marylanders seeking health coverage. The reason why I say this is because our agency is the first and at this time only agency in the state of Maryland to win this recognition from CIO100. We generally don't see state agencies really going, very few state agencies really getting that kind of recognition. Thanks to a great team. And the way we take this appreciation to a different level, what we do is we are applying several of the themes that the CIO100 conference exposes us to on a daily basis in many ways. Innovation is a key component of our culture at MHBE. Innovation is extremely important for the healthcare sector in general. Healthcare is one of the most important services for our people, which has become even more apparent due to the COVID-19 pandemic, which has brought about a new normal for people across the world. Given the high flexibility architecture we have put in place and our agile development approach, we were able to update our systems to provide additional healthcare options to Marylanders within days. We are also working on several of the more detailed themes for the awards. For instance, for example, we are constantly applying modern technology to improve and optimize business processes. We have been growing our customer base every year by providing new business services and technology improvements. We are constantly working on improving the consumer experience and our relationship with our customers. In terms of core technology themes, we have applied artificial intelligence and robotic process automation to our business this year, and we are going to expand a lot this year and the next year. And MHB very much operates like a data-driven business. We have a very deep commitment to security. We are the only state-based exchange to apply biometric-based security for our consumers via our mobile platform. We also are working on completing a full-fledged technology transformation to automatically validate consumer documents through a robotic process automation solution. And recently, we completed a full-fledged technology transformation into the cloud, and we implemented DevOps to make it an integral part of our technology platform. So you can see that our principles, our culture, and our work and our technology connect very well with the CIO100 themes at multiple levels.
Understood. And I understand that subscriber data is really important to this process. So what is the Maryland Health Benefit Exchange doing around AI and automation related to subscriber data and how this is speeding up your processes?
This is a great question, Derek. Actually, we are applying AI and automation in multiple ways to our subscriber data. Again, we are the only nationally recognized health exchange to apply process automation, OCR, biometric security, AI algorithms, all these to automate the time-consuming identity and document verification process. To give a little bit of background, a consumer coming to the exchange asking for, let's say, a Medicaid coverage, what the consumer does is entering the information through our exchange system. And from there, we take the data and it travels to a different agency. It travels to a Department of Human Services, one of the departments. And from there, it goes to another department. From there, it goes to Maryland Department of Health. From there, it comes back to the exchange. From there, it goes to the carriers. So as you can see, there are so many organizations are involved in facilitating one single transaction. And obviously, as many as integration points are there, you are going to see that many number of potential issues in terms of data reconciliation. So what we have done this year is that we automated a process of manually matching the consumer's biographic information. On a daily basis, we see at least 500 such transactions require someone from EDI staff, someone from other agency staff to sit together and match this information and facilitate the transaction. And what we have done through implementing robotic process automation is cut down this manual process by 90% every single day. And the data that is matched by the bot is nearly 100% accurate. So as you can see, on a monthly basis or on an annual basis, we probably saved more than 150,000 transactions very easily from doing all the cumbersome manual work to automating those transactions, thereby reducing the errors as well. So then once we are successful on this, we took it to the next level. Now what we are doing is you are automating the validation part of our QHP, Qualified Health Plan transactions. So we are almost automated 100% of validations at this time. And the next step, we are going to take it to the system security. And after that, we will be taking it to the program integrity side. Program integrity is very key for a government agency. How do we know the determination that we made 1 year back was a right determination? So this is a constant question that we get it from the audits. So what we do is we go manually calculate every rules and then identify, okay, we did a great job or we didn't do a good job. But this is, again, very time-consuming process. And so what we are going to do this year is to automate this process through bot. So a bot can come, take the large last year's value data, and then make a determination, compare it with what we already made, and then come up with some sort of discrepancy report if there is discrepancy. And then we can do some data analysis and see how we can improve the processes. Actually, we can even take it to the next level by having the bot do this every single day. Thereby, we can proactively address the consumer's issues as well. So these are all the great initiatives that either we have done so far or we will complete by the end of this year. And we are really good on learning a lot in terms of bringing all the key components together and enabling an integrated and automated enterprise IT using our digital HICS API, which pretty much digitizes all aspects of our business.
Sure. Can you tell us a little bit more about the AI bots and how you're using them to help subscribers?
Yes. Artificial intelligence is a very valuable concept, but how do we use it? We don't go into a technology just because it is modern and the latest. What we do is we analyze the technology and see what is the real use case for the exchange, for our business, for our consumers, for our partners, and then we see what we can do. In our case, we implemented our chatbot, Flora, and Flora is artificial intelligence-based chat solution. And a year back, Flora was used to pretty much answer the FAQ type questions. When a consumer comes, asks a question, hey, I want Medicaid, how do I get Medicaid? How I want QHP, what is QHP? How do I extend my coverage? Things, very basic things like that. So Flora is very intuitive, and over the year, we could see the quality of the answers were very good. However, we didn't want to stop at that. So what we have done is, in addition to answering the basic questions, if Flora can perform some basic system requests the consumer would be generally asking for. For example, one common theme is consumers come back after a year and say, I need to reset my password. And this has been a growing issue for a lot of the exchanges. So typically consumers go to the call center and then clog up the call center volume, especially during the critical open enrollment period. So what we have done is implemented a conversational AI where consumers can just talk to Flora and get their password reset. This is one small example. However, what we want to do and what we are doing right now is taking the artificial intelligence component into our eligibility determination and enrollment process. What it means is when a consumer is entering an application, for example, if you are asking a question like, what is your modified adjusted gross income? I don't know what is my modified adjusted gross income. I don't even understand these terms. So how would the consumer understand? So when these kind of steps come, the bot can automatically open up and say that, can I help you here? Can I do this? Can you enter this? Can I take you to the next screen? Can I get you to add your family member? So this is a very intuitive way of conversational way of doing a very cumbersome thing, like asking for insurance. This is no less than filing your tax return. It's very cumbersome in many ways because of the policies surrounded by it. However, the technology can really make it simple and engage the user so that they get the right benefit as quickly as possible. So at this time, our AI and our bot are combined in many ways, doing a lot of things in terms of answering the consumer's question, as well as performing some basic technical functions. And in future, going into the eligibility and enrollment determination processes where where the artificial intelligence can do even more for the consumer to ease the pain of their seeking the coverage, as well as getting the answers quickly, and as well as getting the coverage to the consumers quickly.
So that gets at something that I think a lot of organizations are wrestling with right now. And that's where the human intervention comes into play here versus the bot. So how do you determine whether to use an AI-enabled bot versus having a human intervene? How do you determine that?
This is a great question again. Like I said earlier, we don't really jump into technology because there is technology out there we can do it. I mean, that's probably a wrong in our business, at least. It's not a great way to do. So our technology changes or whatever we do in terms of upgrading our technology depends preliminarily on three different things. One is the policy changes. Is there a policy requirement that we have to do? How do we do it technologically? The second is, what is the impact to the consumer? Are we impacting a million consumer or impacting 10 different consumers? So that is a very important component for determining this. And third is, what is this technology? Is this technology really useful for us? Is it sustainable? Can we take it to the next level? Can the exchange be independent and still do this technology, or will be tied with a specific vendor for another 5 years or 10 years? So we look at very closely and decide which solution is apt for us. In terms of artificial intelligence and bot, anything that is repeatable, any process that is generally repeatable process that somebody manually doing is a great candidate for automating. So in our case, we found that transactional automation is possible. We found validation automation is possible. We found program integrity automation is possible. So these are direct use cases. So we go with automation solutions. Well, in terms of human connection, in terms of human intervention, that is where I'm really passionate about, because the value of the people are so important, so valuable than automating through some technology. The people time should be used way more valuably than asking them to do the mundane day-to-day tasks or repetitive tasks, which a bot can do. So the criteria lies right there. Can this be done by a bot while the human knowledge can be used to perform much greater work in terms of analyzing much complex situation or helping the consumer in need right away? So those talents can be put to use to work on escalated cases or critical cases of consumers, as opposed to doing day-to-day mundane repetitive tasks. That is where we draw the line on the sand.
Understood. The key there is using the talent for the higher level work and letting the automation and the AI do some things that frees up their time. So one final question for you, Venkat. What are the top 2 or 3 things that you find have helped you in the IT organization during the backdrop of these unsettled times with the pandemic?
That is a very, very good question, Derek. Number one, I find that we have a great team, and the team that is completely signed on to the mission. I think that is very key for every organization. Your people should love the mission of your organization. I think we are very blessed to have that. So we don't really need to go and motivate people towards the mission. People already signed on to the mission. So that's a great thing. And the second thing is, because they signed on to the mission, they really want to do it. Especially every time we see a transaction, we don't see it as a transaction. We connect the human element with it. Behind the transaction, we all know that there is a family waiting for a critical insurance, or a family is sitting in a hospital desperately hoping to get the coverage. So we really visualize that. We do that in everything that we do. That's why we don't really like function like a typical state agency or a large public organization, where your software changes would generally be done once in 6 months, or once in 7 months, or 10 months, or something like that. We don't do like that. We have software releases every month, and if we see any emergency, there will be a fix on the same day, and there is no excuse for not doing that. So we really signed on to our mission, and we visualize our consumer, and we engage with our consumers, and we operate like a entrepreneurial organization, more or less, in many ways. And I'm really thankful for the support that I get to operate IT in the way what we do from my leadership team and my boss and the board of MHBE. So I really am thankful for that. And that's the secret for us, the secret to do all these things that we are doing right now.
Well, Venkat, it's been a pleasure, and thank you for joining us and sharing your organization's story today.
Thank you, Derek, and thank you so much for the IDG team and the CIO100 team. I appreciate all your support, and thank you again for recognizing our organization. The kind of recognition that you give us is an encouragement for all of us and our staff to perform even higher and higher and set very higher goals for all of us. Thank you so much.
Yeah, thank you too. To our audience, thanks for joining us for this session, and I hope you join us for more sessions during this event. For CIO and IDG, I'm Derek Ulitsky.